Good day, I am Aldrin Havaliano and this is CHN scale hot application. So heat is applied by wet or moist and dry method. So there are four purposes of this procedure. Number one, heat dilates peripheral blood vessels, helping to dissipate the heat from the body and increasing the blood flow to the area. This increases the supply of oxygen and nutrients to the area and reduces venous congestion. Number two, heat application accelerates the inflammatory response, thereby promoting healing. Number three, heat is also used to reduce and relieve muscle tension, relieve muscle spasm, and relieve joint stiffness. And lastly, heat also helps relieve pain. It is used to treat um, infections, surgical wounds, inflammation, and arthritis. Now, there are guidelines or special considerations. Number one, the physician's order should include the type of application, the area to be treated, the frequency of application, and the length of time for the application. Second, the water being used for heat application needs to be the appropriate temperature to avoid skin damage. It should be 115 degrees Fahrenheit to 125 degrees Fahrenheit for older children and adults. Now, it should be 105 degrees Fahrenheit for infants, young children, older adults, and patients with diabetes or those who are unconscious. Now, third, the two common types of external heating devices are aquathermia pads and hot water bags. Now, aquathermia pads are used in healthcare agencies and are safer to use than hot water bags. The temperature setting for an aquathermia pad should not exceed 105 degrees Fahrenheit to 109.4 degrees Fahrenheit, depending on the institution policy. Now, going on to the other, hot water bags are easy and inexpensive to use but have several disadvantages. Now, they may leak and pose danger from burns related to improper use. So, they are more often used in the home setting. For this procedure, we are going to need some equipment, and these include hand washing materials, hot water bag with cover, a bath thermometer, and waterproof pad, and lastly, a pitcher. Now proceed to check the physician's order or the nursing care plan for the application of heat therapy, including the frequency, the type of therapy, the body area to be treated, and the length of time for the application. This will further ensure that the medication to be administered by the nurse is correct and is identical to the physician's order. Then, next, identify the client to ensure that the treatment is being given to the right patient and explain the procedure to the patient to facilitate patient cooperation and decrease their anxiety. For example, good morning, ma'am. Are you Mrs. De La Cruz? I am Aldrin Faye Hoveliano. I'm a student nurse from MSU IIT, and I will be administering heat application to relieve your pain. Is that okay with you, ma'am? Okay. The next, assess the condition of the skin where the heat is to be applied to check the skin's integrity and ensure that applying the hot compress is acceptable for the skin's current condition. And then after that, assess the sensitivity to temperature and pain using light touch, pinprick, and temperature sensation tests. So this is to assess how the patient can tolerate the hot temperature. Then after that, gather the equipment needed to save time and for efficiency. Now, after you've gathered the equipment needed, perform hand hygiene to prevent the spread of microorganisms. Assuming I'm already done doing the hand washing. Next is close the room door or curtains and raise the bed to a comfortable working height to provide privacy and increase patient comfort. Then, assist the patient to a comfortable position that provides easy access to the area to be treated. Then expose the area and drape the patient with a bath blanket if needed. Then put a waterproof pad under the wound area to protect the bed if necessary. This is to ensure patient's comfort. Now after that, pour a glass of tap water to the pitcher and follow with hot water, and then check the water temperature. This will ensure that the water temperature is not too hot or scalding and also not too cold for treatment to be effective. Then after that, fill the hot water bag with 2/3 full of water. This will ensure that the water will not spill out of the bag. Now, remove the air inside the hot water bag by placing it on a flat surface and allowing the water near the opening. And then close the bag. This is to avoid unnecessary weight on the body part, especially if applied to the abdomen, and it allows the bag to mold over the body area to be applied with heat. After that, check for the presence of leaks to avoid the patient and the blanket sheets from getting soiled. Now, after that, wrap the hot water bag with protective cover and apply the heat source to the area indicated for the treatment. After placing it on the area indicated for the treatment, secure the protective cover with a gauze bandage or tape. This is to treat the indicated area and for security. After doing that, assess the condition of the skin and the patient's response to heat at frequent intervals according to the institution policy. This is because assessment can help detect early problems. And remember, do not exceed the prescribed length of time for the application of heat. Then after that, remove the bag after the prescribed amount of time has lapsed, so as not to exceed the prescribed length of time. Then assist the patient to his or her preferred comfortable position to provide comfort. Now, lastly, do an aftercare of the equipment and dispose soiled linens. Now, the aftercare of the equipment will promote organization and cleanliness. It will also allow for the equipment to be readily available for the next use. And also, disposing of the soiled linens will promote cleanliness and avoid the spread of microorganisms. Now, once you are done with everything, perform hand hygiene because contact with microorganisms may occur while performing the procedure. Thus, performing hand hygiene after will help remove the microorganisms and prevents the spread of infections. Then, after hand washing, document the procedure, the patient's response, and your assessment of the area before and after the procedure. This is because documentation will help ensure the continuity of care and coordination between healthcare professionals.